going on. So tonight we have a great discussion as we always do. We have some folks who've been with us before, so they're not new to you. Well, they're not new to a lot of people because they're very popular here in Northeast Florida. But I am not alone tonight in this co-hosting atmosphere. Dr. Rogers Kane is joining me. Good evening, Dr. Kane.
Hello,
How are you?
I'm doing great. I'm just happy to be here and happy to be in the presence of such wonderful individuals.
Rogers
Well,
always
that got
knows
a
what to
chuckle.
say.
Joining us tonight in our discussion. And by the way, Dr. Kane, can you believe we've been doing this for 31 consecutive weeks? Woo for us, right?
Congratulations.
So
Absolutely.
thank
Yeah,
you.
that's
So
fantastic.
tonight's topic is the latest update on COVID-19. Should you still worry? We have two distinguished guests with us tonight. We have Dr. Kim Barbell Johnson. How are you this evening, Dr. Johnson?
I am doing great. I hope I'm off mute. I've been here before, but I'm still not as technically savvy as you are. I'm doing great. It's a pleasure to be here. Always great to see Dr. Goldhagen, who's been my champion and mentor for all of the 2.5 decades that I've been in this town. And of course, great to see Dr. Rogers Kane, my daily partner in this COVID space.
As you, Dr. Kane, as she often says, we won't let her get away. We're always bringing her in for something. So scheduling her.
I tried tonight. I did try.
It's Alberta Pacino.
Also joining us is Dr. Jeff Gohagan. Dr. Gohagan, how are you doing this evening?
I'm doing well. Congratulations on what you've been able to put together. I mean, it's pretty phenomenal. Pretty
Thank you,
phenomenal.
Thank
sir.
you, thank you. And I dare not mention that Dr. Barbell Johnson is with Family Care Partners, and Dr. Goldhagen is with the University of Florida College of Pediatrics. And so both of them has many more things that they're affiliated with, but that's all I'm going to say right now because we'll have more information about them on our website at the conclusion of this evening. So it's been a real hot week here in Florida, and I'm not talking about the temperature outside. I'm talking about the discussion related to children and vaccines. As we all know, many of you who are watching or listening to us heard that the state of Florida, the Surgeon General, said that unhealthy children don't need to get vaccinated. Well, Dr. Goldhagen, I don't know about you, but this is also confusing or can be also confusing to a lot of people. As you all know, or some of you may not know, and then Dr. Goldhagen, I'll chime back into you. For the past several months, I've been working on a project and we've been out in the community with community health workers, really trying to dispel myths and helping people to make more informed decisions about getting vaccinated and utilizing trusted messengers from the community who are out there sharing truthful, factual information. Dr. Goldhagen, what do you say about this whole message? And I'm not going to use the word absurdity because everybody has their own opinion. But what are your thoughts about the Surgeon General's of the state of Florida's opinion about unhealthy children not getting vaccinated?
Well, it's actually healthy children not getting vaccinated. Well, I think I've been in this
I'm
business
sorry, healthy
now.
children.
Yeah, I've been for 45 years, and in my career, I've never seen a politician willing to sacrifice the lives and well-being of children to advance their political careers. And I never thought I would ever see it. We've seen it in not only Governor DeSantis, but Dr. Latipo, who's a physician who took the Hippocratic Oath and who vowed to do what's in the best interest of his patients. These people are reckless and are willing to sacrifice the lives of children in order to advance their careers. Every family does need to make the decision as to whether or not they're going to vaccinate their child. That decision needs to be an informed decision, informed by and through their primary care doctors, other trusted physicians, with the background and support of the American Academy of Pediatrics, the Family Medicine Societies, in our community, the Florida Medical Association, the Northeast Florida Medical Association, Duval County Medical Society, and those are the individuals that families need to talk to and trust. As I've said before, we have only the best interests of our patients in mind. We've been here in the past, we're here now, we'll be here in the future. And the conspiracy theories and disinformation that are being spread by our political leaders is criminal and reckless, and will negatively impact the lives of children in our state. And by that I mean children will get sick, children will be hospitalized, children will potentially die because of the misinformation that they are disseminating. Trust your doctors. I look at Rogers and I look at Kim. Those are the individuals that families need to be going to hear all the information and make their decision an informed one.
JT,
one thing you said, hold on a second, Dr. Kane, I just wanted to make one point, not ask a question. Dr. Gohagan, one of the things that you said, which is I hope that people hear it. Politicians are here for a short period of time. Pediatricians, doctors, physicians, you're going to
JT, you and I were about to make the same point. You've been frozen on the screen right now, but we were about to make the same point. That's what I was about to raise. Politicians are come and go. They may stay here 4 years, 8 years, depending how bad our luck is with that particular. But as far as Jeff has been in this area for greater than 20 to 30 years. I've been here 30 to 40 years. Kim has been here. She's young, so
we won't hold that against her.
She's very young, so but she still she started young.
I have an old soul.
But she's been here 15, 20 years herself. She's also a parent. And the one thing that I agree with Jeff and what he was saying is that these guys are coming and going, and they are giving bad advice to my patients, to other people's patients. They're defying what the experts, whether they're local or national, Florida State Medical Association, as well as the National Medical Association, as well as the American Medical Association, and so on. The association just keep coming, and the experts are numerous in terms of who they are. Just oppose that to what the governor has done, brought together many state employees that are up under his thumb, more or less, in terms of having to not defy him with regards to what statement he wants them to make. And so he's willing to put, as Jeff said, the lives of our children. And one step beyond that, and I elaborated on that in the past, I've said in the past, one step beyond that, in those neighborhoods, those households, whom the inequities of medical care exist, as we see quite a bit in our Black and brown communities, and those that are well underserved. Those are multi-generational households. So while he's talking about healthy children not being affected that much with COVID and not being ill, which is not true, but that's a matter that Jeff can talk about better than I can. They still take it home to their parents, their grandparents, the great-grandparents, and these people are very vulnerable to the effects of COVID vaccine. Go ahead, JT. You're back.
Yeah, and you know what I heard, and sorry about that technology. I gave my disclaimer at the beginning that I moved from one room to another, but and I've heard, sadly, stories of elderly folks or sick parents or relatives who never left the house. And so they had relatives essentially who brought the virus home to them. So we really want to make sure that people understand the consequences of the decisions that they make. you have you know, as many of us say, I got vaccinated for my mother, for my loved ones,
Right.
in addition
Right.
to protecting myself. You know, if only people thought that way.
I'm not going to let this moment pass. I got to say this, and it's just a reminder because some of you've heard it before. I've had a family. It was a family of 6, a household of 6. 4 out of those 6 died within a week of each other from COVID, brought home by the teenager. And 3 out of those 6 died within 48 hours of each other. So it is not just the children, even though this discussion is evolving or revolving around the children, at least the initial part of the discussion. It's not just the children, it is the adults that are as vulnerable, if not more so, in terms of those elderly individuals than these healthy children.
Yeah, I couldn't agree more with both of my colleagues, JT. I hope you can hear me. I was dumbfounded actually just to hear the governor and the Surgeon General for the state even open their mouth with the recommendations. I've been dumbfounded for a while now, but I really, for 25 years, for those who actually were counting, have been in this community. Not quite 45 like my mentors, or 40, but I have been in this town long enough to know that, politics has definitely raised its head at the wrong time. This pandemic has been riddled with, unfortunately, lots of politics. And we who normally spend our time explaining physiology and pathophysiology and how things work and how things don't work to our patients, we must first start the conversation and lead with how to filter the politics before we can even get to the space that we really need to explain to them. Whether it's COVID vaccines or any vaccine, no decision should be made about anything entering into our body as immunizations without a conversation, right? So all of our patients, all patients who actually get immunized, whether it's for, tetanus or if it's for COVID, should have a conversation, which is even more. The emergency use authorization for most of these vaccines, for most of these ages, actually was explicit in stating that you needed to be educated about the risk and benefits before getting the vaccine, whether that was a piece of paper handed to you or a discussion. It was really a joint conversation. When you showed up to get your vaccine, you were saying, I'm interested, and if there was any reason that you should not have received that vaccine, somewhere in that informed information consent process, that should have been identified. The risk of the vaccines have been clear on all of these vaccines and should have always been explained to patients. So this is not a new space. The governor's not entering into the space with new information that just recently emerged. Everything that is of concern has always been a concern, and yet we as a nation have felt that it's been safe enough and effective enough to vaccinate our country, our world, with the products that we have at hand. And the safety signals that have arisen in these trials, and I'm a physician scientist, we have done multiple studies to try to respond to those. And as I've said in other podcasts in this space in the past, when we know better, we do better. So we are not trying to not be transparent with risk, nor are we trying to say that we know everything about COVID. But what we do know, and it would be a shame for anyone to think not, is that these vaccines have allowed us the freedoms that we have to go out, mask or no mask, right now. It is clear that these vaccines have saved hundreds and thousands of lives. Millions in our local communities, millions, obviously, in the pandemic space. For us to throw out the baby in the bathwater is just ignorant. And for the reasons that the governor, and I'm with probably my favorite pediatrician in the world here, so I'm not going to talk about the pediatric cases that the governor and Surgeon General was talking about, or myocarditis in particular, but none of those reasons that they use to justify Florida being the first state in the country to have this policy makes any logical medical sense. Just none.
So what's the word if you go out tomorrow and you run into someone who says they have not gotten vaccinated, I don't trust the vaccine. Dr. Johnson, what would you say to them, knowing that you've been involved in the clinical research part of it?
Yeah, the first thing I do is why at this point, because I've said everything that I know to say. So I just ask why, and I try to meet that person where they are. If it's something that I could refute with science, I refute it with science. If it's something that I could really refute with just how we as humans, just because of human nature, any fears that we may have, or any conjecture, I try to just meet that person where they are and let science speak for itself. I also have no problem sharing my personal experiences with anyone who wants to know why I got vaccinated. And if that helps, that helps. I have 2 children, as Dr. Kane says, one in college and one who's working around the country, literally touring on a Broadway show. And I would totally not be able to sleep at night if he wasn't vaccinated. I couldn't wait for him to get boosted because there is so much trust that I have in this product that I would try my earnest to really share the science and those personal reasons. But which is more, I would try to deliver some answers to their questions. And they're varied, Jocelyn, they can be from so-and-so said, or they said, the infamous they, or it just could be, something that they saw on YouTube. I even with this talking about the pediatric vaccine issues with 5 to 12-year-olds and who's the healthy, I would try to refute whatever concerns they have, or refute the information that's incorrect, the misinformation and disinformation, with the correct information. But I also actually would do my very best to really help us to filter who should be trusted, because sometimes with all of this information in the space, not because you're Black and brown means that everybody who's Black and brown should be trusted. We have a great example of that in the state of Florida, right? Not everybody who's not Black and brown is not to be trusted to Black and brown people. So I would actually try to help people to understand, why should you trust the information, and how do you actually qualify a trustable person for information. If you have been, out in emergency room space in Louisiana and you're chiming in on Florida, I'm going to ask why. Why do we need somebody from Louisiana to come into Florida and tell our governor, what to do with the state of Florida's citizens? There are just so many people out there that's trying to find a cause and run with it. But the science is the science. And like I said, while we don't know everything, I think that we have advanced to this point in our communities because of the advances that we've made in science, and because of sound clinicians who've trained me, who are still here advocating as our allies in this space for us to do the right thing. And really that's the best that I could do. And if the answer is, okay, let me think about it, it's a win. If it's no, then I'll try again tomorrow.
Yeah, someone said to me, knowing I was talking to them that we were doing this topic tonight, and they said one of the things that our governor has said a lot is that parents should decide what decisions they make for their children. And there's another bill in Florida that legislators have been saying parents should make the right. So that this person said to me, that being the case, why did the governor tell those young people to take their mask off the other day when he was at that press conference? So
unless he was their daddy,
right? If parents told their children to wear their mask, why would the governor put them in the position to respect authority and go against what their parents said? The irony of that is what somebody pointed out to me. Dr. King, what are your thoughts on that?
Well, I'm going to defer to Dr. Goldhagen on that one. I want to hear from Jeff and what he has to say on that one, because, he and I are pretty much in agreement, but he does articulate quite well what our issues are with the governor. So, Jeff, what's your thought?
Well, I think it's clear. If you have to ask the question why, and I don't mean this with any disrespect by any means, then you don't understand the situation. These are people who are placing their political careers as a priority, irrespective of the fact that tens of thousands of people in the state of Florida have died unnecessarily. We've had over 65,000 deaths. Many of them could have been prevented with the right policies. Now he is sacrificing the lives of children to advance his own career. So the answer to the question is a really simple one. This is an individual who's willing to do whatever it takes to become the next president of the United States. And Latipo is connecting his future to Trump. I mean, to Trump. There's what you call a Freudian slip to DeSantis in order to become the Surgeon General. And these are people who you might read about in a novel or see as the villains on the big screen, but here we have it playing out in front of us, and they're willing to sacrifice the lives of children in order to advance their careers. It's a shame to have to say that, but that's the answer. And yes, parents, for COVID at this point in time, although one could argue there are places around the country that are saying if you want to go to school, you got to be vaccinated. If you want to go to school, then you need your DPT, you need all of your vaccinations. The misperception is that this is a new vaccine, that this is new technology. Well, the technology has been around for decades, and there's a lot been known about it. It's been used now to make this vaccine, but it's not new technology. So we do know a lot about it. And ultimately, end of the day, we also know that whatever reactions you get from this vaccine are far less than you get from the disease itself. And the critical issue, which is still left unknown, as Kim said, is we know what we know, right? But we don't know what the long-term effects of COVID infection is. But we do know there will be long-term effects. We do know there are effects. We do know if you look carefully, you'll find biomarkers of systems that have been impacted by even asymptomatic disease. We're learning a lot more now about the adult long haul COVID, which in fact is probably a misnomer. It's post-acute disease, right? And so, in adults, and we know more and more ramifications are being identified, and there will be another pandemic. There will be another variant or another virus. People forget we had HIV, and we had SARS, and we had MERS, and we had Zika, and we had H1N1. Now we have SARS-CoV-2. So this is nothing new, right? This is nothing new. Zika, forgot Zika. And there will be another
Ebola.
And Ebola, right. And so this is nothing new, and we will. So the best way of protecting children today for what's coming tomorrow is to get them vaccinated.
And people are still dying, Dr. Goldhagen. People don't think, maybe no one in their family.
1,500 people a day are still dying.
Right. People are still dying. And because we see people out and about going this place and that place and crowded bars and stuff, it doesn't mean that the virus has gone away. I asked Dr. Kane recently. I said, Omicron is the dominant variant now. Did Delta just go away? And people have to understand, if you know people who've gotten COVID and they seem to only get flu-like symptoms, that's because those people were probably vaccinated, right? They may not have shared that part with you. But for people who are unvaccinated, people are still dying, and I think that's the message that people don't hear. We, at the Partnership for Child Health, they recently released a campaign called Let's Get the Vax Jacks. And what they did is use trusted messengers from the community, local pastor, physician, a mom who is a physician and she's expecting, use a young man who said, I did it for my mother because her health is compromised. Someone else, all of these folks are out there. And I urge people to go to letsgetthevaxjacks.com to learn more information from people, quite honestly, who look like me, since in the African American community, there's still a lot of myths out there. People who made faces that may be familiar with you, to hear their story of why they get vaccinated. You're hearing of these folks.
I like to pose the question, when did vaccines become villains? I mean, there's proof, there's a track record with vaccines in terms of how they have saved lives. Polio, measles, mumps, rubella, yada, yada. But there's also a program, and I'd like to bring that to, put that on our website. A tried and trusted program in the Alachua County that showed where the benefits of vaccinating these kids in public school really saved lives. It wasn't about COVID, but it was about vaccinating them. And they did the necessary gathering of data to prove their point. And this was within that public school system in Alachua County. And I think some of the counties, and Jeff, you may be able to elaborate on this. I'm not as astute as that as you are in terms of some of the public health related issues. That has become one of the models by which people were, before COVID, giving vaccines, even when it came down to the flu vaccines and the benefits of the flu vaccine. You know anything about that Alachua County program?
No, Alachua County was one of the counties in the state that did impose a mask mandate and has suffered significantly for it as far as finances. And I'm going to apologize. I'm going to have to break, but let me thank Kim. Kim calls me her mentor, but it was the mentorship went both ways for sure. And when you get to be old like me, and you look at people like Jocelyn and Kim and say, it's a wonderful legacy to see folks take over from here.
I know that you have to go, but I would be remiss, Dr. Goldhagen, if I didn't tell you how I continue to feel grateful that you introduced me to the community, just 3 years out of residency at Mayo Clinic. And really, that's where my heart was. And to have a leader whose heart was even bigger than mine and who was even more motivated than I was just unheard of. So I'm truly grateful for you. And when we talk about trusted messengers, it's people like you that I really hope that this community sees, because you have nothing in this to gain except for the benefit of the people that you have loved and taken care of for your entire career. So thank you for mentoring me, but for taking care of the children of this community.
Wow, and I appreciate all of you. But you're wrong about that. Fame and fortune is what I'm getting from this.
I'll be on your coattail.
All right, take care, folks. And thanks for the listeners, and spread the word and listen into this show. This is pretty amazing. And I'm going to leave the studio.
Thank you. And I read a statement from one of our trusted colleagues who said, COVID vaccines are safe and effective in preventing severe disease and death. One must follow the science and evidence. Current scientific evidence clearly supports vaccinations of all eligible individuals, including children. Millions of dozens of COVID vaccine have been given, and vaccine has been found to be safe. Recent surges of Delta and Omicron variants also clearly illustrated the effectiveness of the vaccine in prevention of severe illness, hospitalization, and death. We must protect our children. Health of our children and all our citizens is paramount, and vaccines are the best tool in our toolkit to protect our citizens, including the most vulnerable, our children. Most pediatricians and other physicians, the American Academy of Pediatrics, the Centers for Disease Control, the World Health Organization, and almost all other credible organizations recommend that children 5 years and older be vaccinated with COVID vaccine to protect themselves. And so again, we're doing this show, and some people may say, folks, listen, I'm tired of talking about COVID. Well, we're not tired of talking about COVID, because I'm not a physician. I'm just a little old health educator. And quite frankly, I read, there are still people dying of this virus. And if people just don't hear that, why do we wear seatbelts, Dr. Johnson and Dr. Kane? Why don't we just go out, don't wear our seatbelts? Why would we not just walk across the street and not look both ways for traffic? This is just another way of protecting ourselves to enhance the quality of our lives and extend the longevity of our lives. why people are still, and by the way, somebody said the other day, people are not getting vaccinated because they're riding on our coattail of those of us who have gotten vaccinated. And what do you say about that, Dr. Johnson? That put a smile on your
Yeah, I
face.
mean, it does. I see those who are benefiting from the people who are doing the right thing the world over. I mean, and so I do agree with that statement. And we used to talk about what is population, immunization in the beginning, but really, every single time I look at someone who is really just dug in for all the reasons not to be vaccinated, I'm smiling on the inside, recognizing that they are like my forefathers were, allowing people to have the benefit of their life for the work that we're doing. And it's not any different to me. And I just listen with those ears. I said, my generationally, that's exactly what happened. My forefathers did a lot of hard work so that you could have the privileged life that you have. And I'm doing the same thing. So you know what? It's all fair in love and generations. But it is a reality that we are doing what we are doing is helping those even who are unaware or unwilling to accept the benefits. I just wanted to just because Dr. Goldhagen, has gone, I wanted to just tag on to what he was talking about with regards to long COVID and this post-COVID sequela, because a lot of what we're talking about when we start talking the numbers of deaths, we want to stop there. Oh, well, kids aren't dying or this group isn't dying. But the burden, like you said, Jocelyn, of COVID-19 on the community, the quality of life burden, the chronic disease sequela, we are still yet to define in medicine. We are, as a medical community internationally, really still challenged to understand what COVID is going to, post-COVID medical post-COVID chronic disease management is going to require years from now. I wanted to share just two things that actually were recently published, one in the Annals of Internal Medicine, and just briefly, this was March 7th, but in Annals, they actually talked about brain changes seen after mild COVID infection. Why would I want to have any COVID infection if I'm going to have brain changes? And again, while these studies are still, some of them are small studies and we really need follow-up studies to kind of understand, but this study was actually done by University of Oxford in England and published in Nature and published in the Annals of Internal Medicine, talking about COVID patients who had greater reduction in global brain size and looking to see if the participants in that trial actually had any cognitive decline or just thinking issues, and then to see if that was reversible. And only time will tell those things. So in my opinion, if I can avoid something in the beginning or have a better chance of avoiding it in the beginning, rather than to find out 4 years from now when the follow-up studies for these kinds of studies are published, that I could have prevented. And it's not to function from fear, but to use the science that we have. I mean, this is clearly physiological MRI detected changes that are being seen. And again, we're looking at everything from regularity of menstrual periods to brain size. I mean, there's not a part of physiology that isn't being studied with regard to COVID. Some of it is before its time, like we're not ready to really say exactly what the conclusions are, because just like we all said in the beginning, things take time to understand the entire process. So I'm not ready to rest my laurels on the conclusions of any of these studies, but I'm saying if we're seeing hints of physiological change, and even in our clinical situation right now we're seeing a lot more back pain presenting with the Omicron variant population. Do we know if that's because a lot of people are sitting every day in this post-COVID space, and so that's the inflammation that we're seeing, or is there something in particular about the variants that's actually creating musculoskeletal issues that we didn't see with other variants? These are things that we're thinking about, we're seeing, we're studying every single day. But the long-term effects of what these things will bring, we don't know. We're just at the beginning. And while I think that we are a smart enough world to have moved further along, I mean, I'm just like you. I want the therapy that works. I want the test that works. I want the diagnostics that work. I think we're smart enough. If we can send a man to the moon, we should have really used our billions of dollars to be further along. And in some ways, I'm probably not wrong, because I recognize that there have been political hiccups and all sorts of other hiccups. But we have the science and we have the potential. But this virus has thrown us for a loop worldwide. And we've really been struggling to really get to the diagnostics that we need. We are at a place where we have therapeutics, and just remind me to mention more about the test and treat
we're going to get into
program that actually was launched on March 7th. But again, we're at a space, like, I think that we need to understand that about COVID. And then one last thing before Dr. Kane, you actually, I think you're going to ask me a question or make a comment to my comments, but just take COVID off the table. Just take COVID off the table as we look at Black and brown people in general. The world is continuing to turn. As a family physician and research scientist, Dr. Kane and I are looking at everything in the family medicine scope of care. And Annals actually also has been clear that we have not changed the outcome for a lot of the things that have caused havoc on our community. The health disparities are still there. The zip code that you are in has created more havoc and continues to create a havoc because of lots of issues related to social determinants of health, access, and otherwise. But what we do know in science is the science. And the association, there's another article that I thought was very interesting, a cohort study, that was the association between the socioeconomic disadvantage and the decline in function, cognitive, and mental health after critical illness among older adults. Not COVID critical illness, just critical illness. You get so sick that you're in the ICU, and then the decline that happens. And we all know a story or two about these kinds of patients who get so sick and then they never really get back to where they were before they got out of the hospital. And looking at just the socioeconomic disadvantaged populations and the impact of just chronic illness, again, if grandma and grandpa are taking care of, even if it's for 4 hours a day, of a child between the age of 5 and 16, or any age that our state leaders are thinking should be immunized, and that increases the chances of them getting ill with this or ill with anything else, we're still at a point where we must remember to pull up and to recognize that we are still a fragile population when it comes to chronic health disease management.
The ironicity, two things. The ironicity to what we're talking about as it relates to COVID is that if looking at what the ill effect that COVID has produced on our society, when we're talking about the long COVID, the problems with your lungs, the problem with your heart when you've had COVID, problem with your brain, and so on and so on. If I put the shoes on the other feet, as they would say, and if it was the vaccine that caused that, they'd be up in arms and saying, don't do the vaccine. Mm-hmm. But here we have the virus that causes it. Mm-hmm. The vaccine that tried to prevent what the virus caused. And we're accepting that for whatever reason, whether it be political or whether it be out of ignorance, we're accepting that, at least the vaccine didn't bring me to this point of being that ill. Mm-hmm. Because when you look at it, the things that you described that happens with long COVID and the after effects of COVID is scary. Mm-hmm. And so, but they're more scarier than the vaccine. Mm-hmm. But people tend to be running from the vaccine. And I think a lot of that is the hyperbole associated with the politics and yada, yada, yada. Mm-hmm. The other quick thing I want to say is, and respond to, is that you're absolutely correct, Dr. Johnson. When these elderly individuals, like you say, put COVID to the side, these elderly individuals become ill from whatever reason, and they start getting themselves isolated to a facility, it may cause some permanent damage. I had a lady she had COVID. She got COVID because it was brought to her. She never went anywhere, but it was brought to her by family members mm-hmm. that were not vaccinated. And they wound up staying in a hotel for about 10 days because that's what they were trying to isolate themselves. This lady went into that hotel totally lucid. Now, I grant you, she was 93, 94, totally lucid, make her own decisions. She always amazed me. She was sharp and so on, so on, so on. When she came back out that hotel and came to see me, one of the reasons they brought her to see me pretty quickly was she was hallucinating, hearing voices, and she had decompensated, went down so far mentally that the family was really afraid to leave her by herself because they wasn't sure what would happen. So she's hearing voices and seeing, I'm not trying to make light of it, but seeing dead people, people that were not around anymore. And she was nowhere near that before either COVID and or the isolation that took place as a result of COVID. Could I say it was COVID? Could I say it's COVID? No. Could I say it was as a result of the isolation? No. But I can say isolation and COVID, after that happened, this woman came out much, much less self providing.
Yeah, and the temporal association between many of these stories are just really, I mean, it's alarming to us as clinicians, because as you know, with all things, there's a bias in medicine. We don't want to actually call everything because you walk in and you say, because I was out in the yard, I had this rash. It's not something only because you were in the yard. We have to have what we call a differential diagnosis. We have to think about other things and make sure that, if you don't think about it, you don't diagnose it. So we want to rid ourselves of those biases. But it's really hard with COVID to really not think of COVID being associated and not to at least document that association, because a lot of the things that we know now, we didn't know until after years and years of putting that body of information together. So it's important that we capture that information, as we say in science, so that when we see these continued associations where everything else has been ruled out, that we can then define these side effects of the disease or the treatment or the vaccination or whatever it is. So could it have been a urinary tract infection? Well, yeah, of course, right. But you tested it. Exactly. So we continue to look at this differential. And then when there's nothing else left, right, it's not like we must consider the things that are just most obvious. And while they can't be conclusive, there are medical, it's curious to us in the medical community, but we must document those things.
And JT, so we're going to get to the current treatment deal, but the only other thing I was going to ask was.
And I had a comment before you asked another question, if I might.
Okay, go ahead, make your comment.
The comment is about when you talk about the long-term effects of COVID-19, we think of your patients. What about on clinicians?
No, it's long and short term.
I have a friend right now whose family member has an illness, and now this friend, and I'm not going to identify them, put their business out. They're sending me articles like, "Oh my God, I wonder if this is what's happening with my relative," because they were in an environment that was known to have a lot of people who were sick and dying of COVID a year ago, right? And now that 2019, 2020, I mean, we say COVID-19, this is 2022, right? So you think about clinicians who survived COVID, but what's happening with the long-term effects for you all?
Yeah.
Well, and the one thing I will say, I haven't had COVID because I've been blessed enough and tried to do all the things that was necessary to make sure I don't get COVID, and also protect my family, and because I did it for my family. But I will say, in addition to clinicians, since we started out on the program with pediatrics, the teachers, okay, that are being exposed to COVID because of their students, and you're telling them not to get vaccinated, their kids. But these are the same kids that come in and these teachers and exposing them, telling the teachers not to wear masks or telling the kids not to wear masks, but you're putting these teachers at risk. And these teachers are resigning in blocks. And the after effect or the side effect of those resignations of these teachers leaving the system is that now we have less teachers to teach these kids, which means we already have an overburdened classroom, okay? That the state doesn't want to pay the teachers enough money in the first place to stay, but they're overburdening them with other teacher students, okay? And I had a teacher today, that's one of the things they reflected on. With other teacher students, and they're about to pull their hair out So there are ill effects that go around, not just with healthcare professionals, because the nurses, that were at one time, they were all getting burned out. Respiratory therapists getting burned out. Physicians getting burned out. Not so much the hospital administrators, because most of them were dispatching those individuals to go do the dirty work while they were behind their office desk.
I don't know if that's fair, Dr. Kane.
Well, some of it, that's what it was. I'd say dirty work, maybe being a little unfair, but they were protecting themselves, but they also wanted to run their business to make sure that the hospital didn't suffer as a result of COVID, suffered as little as possible.
But we did have doctors like Dr. Leon, rest in peace, who actually were administrators who were out there with us, shoulder to shoulder. Not the exception and not the rule, but I don't want a broad stroke.
Yeah, no, and I wasn't trying to broad stroke. All I was trying to make sure is that people understood that it was more than just as you asked Johnson
About clinicians,
JT, as you asked, it wasn't just us providers. And I wasn't looking. I want to make sure people wasn't understood. We were not looking for sympathy. We went out there to get our job.
The people who clean the hospital rooms.
And exactly.
The people who clean your offices.
Right.
You know what I mean?
So the one other thing I just want to make sure, and then we're going to move on to the current recommendations, and because we're getting short on time. One other thing I wanted to bring out is that when we're looking at the individuals, and when we're looking at COVID and what is going on with providing care for these individuals, we must absolutely allow people to get an opportunity to protect themselves from others who may be bringing harm to them. People are quick to say that, you guys got it wrong in the beginning, and so we don't want to do this and we don't want to do that. We didn't know. We were in a stage where we were trying to prevent a major medical pandemic event that was a threat to millions and millions of lives, locally, statewide, nationally, and worldwide. We were really trying to understand this virus. So to come back now and blame us for whether or not we got it right or wrong at that time, we used the best scientific evidence available, which there was none. This was a new virus. Information on stuff like that is gathered as you begin to experience it. And that's what I want people to understand. If you start saying you guys were wrong when you said this, that, and the other, well, if you get married to somebody, you don't marry somebody that was brought into you and you met them at the front door and the first time you ever seen them and expect that to be a good marriage. You try them, or you go buy a car, you kick the tires, you do this, you do that. You get an opportunity to examine what you're dealing with. And here we are. COVID just hit us in the face. We didn't have an opportunity to learn from COVID until we had an opportunity to learn COVID. Period. I digress.
So now you want to talk about treatment, because I know in the state of Florida, I know we have people who live all around the country, but in the state of Florida, the Florida Department of Health has is advertising treatment options. And some of the things that they said and I took a screenshot of it, by the way, it says emerging COVID-19 treatment options: monoclonal antibodies, fluvoxamine, inhaled budesonide. And I'm just thinking, okay, so I'm not, obviously, I already said I'm not a clinician, but Dr. Johnson, Dr. Kane, are those emerging COVID-19 treatment options?
Well, some of those are emerged. So we are in a space, like Dr. Kane said, we're not in the same COVID space as we were in 19 or 20 or 21 for that matter. And so while, again, I would like quick, fast, in a hurry, we don't have all the answers, but we are in a better space. as we remember, I don't know if you're getting a feedback, but we're in a better space. As you know, we really suffered most of our deaths pre-vaccination, right? Pre the emergence of vaccines. And then even as the variants emerged and our ability to test variants, because we had to actually come up with the technology to actually be able to identify that and share that information, we kept gaining information. And in the background were those who were trying to find the best therapeutics, the best treatment options for this, lending on other science for other viruses, because we've been in the antiviral space before, lending on the science based on what we know about antibodies, whether it's a vaccine created antibody or an antibody that a monoclonal antibody that we create to mimic what the body would do. So we've been emerging and evolving these therapeutics for quite a while, and some we've learned have been better than others. So what we have right now, and what actually you may have heard about in the President's State of the Union address, is really an opportunity that the country has in most communities to get tested with treatment attached to that treatment. As we move forward, this is going to be rolled out across the nation with basically 2 antiviral treatment products. And those are the Merck product, that's the Merck product and the Pfizer product. And, you know, for simplicity, I'll just say it's the treatment pills, right? One is a 1 pill, one is a combination pill. But they are now, as of March 7th, part of what our government has named the Test to Treat. The Biden-Harris administration has named Test to Treat initiative. And that initiative rolled out on the 7th. And it's really, you know, an initiative to allow you, if you're tested positive, not to, or find out that you're positive, not to have to go wait and find a treatment for that. Because if treated early, it decreases the chances that, again, you're going to be hospitalized or intubated. And right now in our community, I just actually called, because Dr. Kane called me right before the show, and I was like, I don't know. But I actually called around really quickly to find out really if we were up to speed on that. And I called to at least one of the CVSs, and what they said, consistent with what the initiative said, because the initiative said that they're going to roll this out to community health centers and pharmacies attached to a clinic, like a minute clinic. So to those contracted CVSs with a minute clinic attached, they are currently stocked and providing treatment if test positive at those sites. Of course, community clinicians like myself and Dr. Kane have the opportunity to write prescriptions should we see a COVID positive patient and they're able to pick up the prescription. But the nice thing about this initiative is it's actually brought the medicine to our community. And if you remember just 6 weeks ago, we were calling every single day based on this website to see, do you have monoclonal antibodies? Do you have antivirals in stock? And most people were ready to receive them, but they didn't have them on the shelves at the pharmacy. So the nice thing is that this community actually is up and running, at least in Duval County, at least. And again, my phone call doesn't represent any stake that I have in CVS or in the products for that matter. But it's nice to know that that we do have antiviral therapeutics in our community for COVID-19.
It still doesn't take the place, Dr. Johnson.
Absolutely.
That we want people to get vaccinated.
Yeah,
it's
absolutely.
Just an option.
Absolutely.
If you get the virus, this is an
if
option.
you're vaccinated or not, correct. And again, this is the way that we talk about vaccines or we talk about masks, we treat them like they are like the thing that is part of the COVID management. This is a multi-layered process for disease prevention and for disease management, for individual protection and for community management. So when we look at all of these things combined, most of the times we're talking about, the treatment or the threat to that individual. And other times we're talking about the community, and sometimes we're talking about both. But in all of these scenarios, they are decisions based on multi-layered interventions, right? So having the vaccine on board is always going to be best to decrease both your chances and, from the science that we have, decrease the severity of the disease. Should you have the disease, can you get sick and achy like everything else? Yes. So what now do we have that we didn't have 6 months ago in our community? We now have therapeutics, because before we were only offering symptom management and nothing to decrease the viral load in the body. So now we have antivirals that can decrease the viral load based on the developed science that created those antivirals. 100%? Absolutely not. But it's the same way that we provide you with prescriptions for influenza antivirals, right? So like you would get within a period of time that you're eligible, if you're symptomatic and you presented to me and I tested you and you're positive for influenza, I have the opportunity to give you some symptomatic management, or I have the opportunity, because of the science that has evolved in the influenza treatment space, to actually provide you a prescription for one of the few influenza treatments that's available. And as a scientist, I've tested the one-day therapy, I've tested the multi-day therapy in the influenza space. I have not done any of the tests. So again, I have no horse in the race here for COVID antivirals, but I'm excited because it is exactly what we need to actually have yet another layer to save lives and to increase our normalcy, our new normalcy, and to allow us to have choices in our community.
You know, I remember when this first came out, and before the vaccine, my patients would call and say, Dr. Kane, I have COVID. What should I do now? And all I could do was treat the symptoms.
Mm-hmm.
You know, that's when you talk about like that budesonide.
Mm-hmm, mm-hmm.
Okay. And before Omicron, when we had the Delta variant,
Mm-hmm.
yes, I could also recommend to the appropriate individuals, I could recommend to them the monoclonal antibodies.
Right. That was when we had remdesivir. And even then, like remdesivir was mastering the game with some of the early variants,
Right.
But then we learned with Omicron that it wasn't helping.
It wasn't helping. The virus evolved and learned to evade its death from those treatments that we were using initially, like the monoclonal antibodies and remdesivir. The virus evolved, and so lo and behold, we got Omicron. So, but now we have newer medications to address those newer variants, and Paxlovid and a lot of these MAB viruses.
Yeah.
It's difficult to pronounce drugs like the Bleptovir, and
but the two that's part of the initiative is the Paxlovid again, and then the easy way to remember the other product, which is the Merck product, is to break it up into two parts. So it's Molu, MOLU, and then Piravir. So Molnupiravir, and Molnupiravir is the Merck product, and again, that is one of the two products that's available in the community health and distribution by the federal government and the pharmacies attached to clinics. And then if you look at, and this has been new for me, I stepped away from some of this information and learned that all of this was now in the office of the Assistant Secretary for Preparedness and Responses website, versus I was just going to other places at the FDA or CDC. So a lot of this now has been put under one central umbrella for this information. And so it's the ASPR, or the Office of the Assistant Secretary for Preparedness and Response. And, whether you Google that or you Google ASPR COVID treatment, that's enough to get you where you need to be, because you're going to land on this page or you're going to be redirected to these pages. And that gives you an opportunity, depending on whether you're in this county or others, to actually go to what were those old maps that said medicine is coming. These are the maps that now will allow you to see which, across the country, which pharmacies have ordered medications and where you can go to try to get care or your prescriptions filled.
The bottom line is prevention, which I'd rather,
and that's it.
Road, okay, more so than the
treatment
road, because there's no guarantee with treatment. At least the prevention, whether or not it prevents you from getting the disease or prevent the severity of the disease is much better than having to deal with trying to find treatment for the disease. But the Biden administration has made treatment for the disease, should you get it, should you contract it, has made it a lot easier. And finding out whether or not, first of all, it made it a lot easier finding out whether or not you have the disease, so they increased the testing capability.
Yeah, and we need to, and just, I'm sorry, Dr. Kane, we need to look past politics, because as you look at this information, you will see that, pharmacy companies have brought this at a cost. There's politics that's being discussed on social media about whether this is available only for our country or other countries, and is a $700 course of treatment. Who's making money from that? So we need to look past all of that and just make sure that at this stage of the game that we understand that this is the best that we have right now, and then we can work on the politics to make sure that it's accessible for everyone. Right now, we're doing all that we can to make sure that disenfranchised communities in this country are having equal access to the things that are available for all people. But again, this is a pandemic, and we must worry about our brothers and sisters in the Caribbean. We must worry about our brothers and sisters across the oceans, whether it's West Coast or East Coast, because again, this is a pandemic and our borders are not closed.
And our listening audience, though, the easiest thing to do is get the vaccine and do the prevention within our listening audience. So you don't have to worry about what the cost of the treatment may be to you.
Right.
Get the vaccine. We know it's free.
Right. Okay. I mean, it's free to us.
Yeah, right.
Right. It's free to us. Right.
It's free to us.
And the treatments are actually free, to the patient as well. But there's a cost to all of this in the background. There's an intellectual property cost. There's a cost. But I only bring that up because these are the things that actually stand in the way of us. We cut off our nose to spite our face sometimes, and we worry about the wrong things. And when it comes to an opportunity, we've heard tons of stories from our clinicians who are serving as hospitalists that said, the heartbreaking part was when, mom and dad was dying, that everyone was like, can I get the vaccine now? And it was too late. Again, before we get to the stage where our health care is deteriorating, that there are antivirals should you get it. But yes, masking and prevention. We still have hand hygiene, cough hygiene. We have all of the things that we must still do, because while we watch the numbers in our counties that we live in change, if you go on to the CDC to look at the clinical consideration documents, we mentioned some of these counties before. In Florida, most of the state is what we call yellow and green, but there are still red spaces, which is high numbers of COVID, where masking indoors is still recommended. And those counties, as of today, were Hillsborough, Polk, Hardy, Highland, Alachua, Levy, Taylor, Hamilton, Gilchrist, and Columbia. I think I may have missed one or two, but again, you can see the pockets where the burden of COVID disease is still high, and the equation by which the CDC is using is looking at not only the incidence per 100,000 individuals of COVID positive PCR tests. We're only looking at PCR, and we're doing a lot of self-tests. So we're looking at the number of COVID positive PCR tests that's reported, as well as the number of hospitalizations with known tested positive. Whether you were hospitalized for COVID or you're in a bed with COVID because it's requiring more resources and isolation, et cetera. So it doesn't matter if you went in for COVID or if you happen to be COVID. Those are the two things that we're looking at as we decide now, as the CDC recommended, and as we look at the high, medium, and low levels of risk in your community. Again, we're at medium risk in the community that I live in, but I'm sure that JT and Dr. Kane, you have a listening audience around the country. So if you go to the CDC and you want to look at what your community's risk is, or if you're traveling, as I did just recently, look and see what the risk in that community is, so that you can, guide yourself appropriately. Before I went to, where did I go? I went to see my son. Again, I brag a lot about him, but he's my Olympian. I went to see my son this weekend perform in Wisconsin. And before I left, I looked up the numbers here, and I was masking everywhere I came back, and we had changed, from red to yellow. So, and I knew something was up because I came up the airport, went to Publix, and no one had a mask on except me. So apparently that information got out really quickly, or maybe I just didn't notice that everybody wasn't wearing a mask except me, but exactly. So I just want you to have the information. Like I said, information is power. It still is. I know that we're running over our hour together, but this information is an ever evolving space. And I am in the thick of it every day, both for what I do and because of opportunities like this to bring you the information that I have. There's nothing that's out there that I'm 100%, carrying the water for. I am not, whether it's our vaccines or our therapeutics. I mean, there are risks and shortcomings, and it's not one size fit all, like I've said before, but it's one size fits most. So unless in the vaccine space, for example, you have some kind of immunocompromised condition, or you have one of the other risks that actually makes that more likely to be dangerous for you, please continue to look at the vaccine. If you've been vaccinated with your full complement of vaccines and you've been boosted and you're wondering what's to come, so are we. We still are not without a clear understanding of how long our current immunity is going to be robust enough to handle what we have. And we don't also know what's coming. So only time will tell, but stay open and fluid to that information so that you can be ready to receive that information in a healthy space.
Okay.
Yeah, one of the things that I think about, and I know we're again nearing the end, but I had a conversation, and I have to ask you all, toss this out at you, because I had this conversation with some young adults, and they said that when the virus first came out, it was one person said to me, the people who were getting it and dying were old, sick, or fat.
Mm-hmm.
That's what this person said to me.
Mm-hmm.
And they said, I'm athletic, I take my vitamins, I eat right, I'm not going to get. Well, we know athletes who've since tested positive, Olympians who tested positive, who were at risk for not even performing at the recent Olympics.
Mm-hmm.
So I think the thing that I would like, as we near the end of the conversation, is to talk to those young people, young adults who are the parents of young children, who have elderly relatives who they love and want to go and visit. Share your final thoughts to them as they make the decision to not get vaccinated, and urging them to get vaccinated, not just for themselves, but for their loved ones.
I guess I'll start. Again, I've touched on this throughout the hour, but the safety and the efficacy of these vaccines cannot be understated. We are learning about signals, and we are responding to those in the scientific space. But overall, we are in a space where you should not doubt the safety or the efficacy of these vaccines. And really, you're smart enough as a population at this point to weed out the politics. So once that's done, I think that it's important that you actually take the information for what it is. The historical concerns that we've had as a people concerning our trust for the vaccine, take the information for what it is. We are at this space right now, and we are here making sure that we are getting what needs to get to people who look like us, to the people who look like us, and to everyone for that matter, because we're in this pandemic space. As a mom, I just want to say that, as you've heard, I have a post-college age child, and I have a college age child. I really rallied to make sure that she was ready for college and got vaccinated. I watch her pictures on campus to see that she's wearing her mask. I look at the university, because she's in Virginia, and they've changed some of their indoor policies to permit some liberal policies in certain spaces. And of course, universities are free to do what they want to in their spaces. But, I make sure that I send my children to school or to work with the science that will help them, and to make sure that they survive, that they are not one to have chronic disease that's unnecessary chronic disease. There are things that they will have to deal with, and which is more. We don't spend a lot of time talking about the mental health, except for like the exhaustion of care. But this disease is an inflammatory disease. And just like it impacts our bodies, it's impacting our minds. And it's impacting our minds in a way that our mental health is being impacted. And I don't think that we share enough of that information. But I want to say, for the purpose of this little bit of conversation, that we've been talking, especially through Black History Month, about some of the historical things that we have now seen generationally that impact us. We have science that is actually testing our DNA and our genome to see if we can actually recognize and call a spade what it is, because of the impact of environmental things and trauma to our lives. We don't need to have another traumatic generation because of choices that we made not to immunize our kids or to allow them to be in a space where they got sick and increase the burden of disease for their adult life. If we're worried about their safety and what's going to happen to their sperm count or what's going to happen to their periods 20 years from now or 15 years from now, be just as smart to worry about some of the other things that we have proof for, that we are emerging in that space. So none of this is really just one size fit all, like I said, but there's a lot of reasons for you to weigh the benefits and the risk. And my family, we came out thinking that the benefits were 100% worth it when it came to the relative risk. But I hope that families who are still listening and still unsure will push the envelope to get the information that they need and to recognize that they need to pull up and look at some of the other things that we're not talking about, that we're not qualifying. That's really part of quality of health. And that's basically how I will end my last couple of statements with you.
Well, I will say this, Ms. Turner, I'll say this, and just remind people, our minds are part of our bodies.
It is.
And so as they become, if our bodies become inflamed, there's nothing that stops that. There's nothing written in stone that says our mind cannot become inflamed. Mind meaning the brain in itself.
The neurological system.
It is what creates the neurons and the pathology and physiology of our brain is what create our minds. So that can become, can suffer as a result of inflammation of the pathological part of our bodies. Now, what I will say is the other thing in talking to what you mentioned before, it being fat or old or out of shape, we saw a lot of deaths in that particular age group. But I also saw quite a few deaths in those people that were healthy, had no problems. You've had EMTs or firefighters, nurses, physicians, policemen, that these people were in shape. They tried to do the right things for themselves. And yet, especially before the vaccine became available, and other treatments became available, they contracted the COVID and died. And even some of those who may not have died, and I always go back to this Sentinel event that occurred, Jocelyn, when your alma mater was playing Florida State, FSU was playing Florida State, and that the University of Florida player dribbling down the basketball court dropped in his tracks and had to receive emergency medical treatment because he gotten COVID and he had the ill effects, even though they were not even the immediate effects, but he had the ill long-term effects of the COVID virus with myocarditis and so on and so on. So, and he was as in shape as anybody, and for some of the parents that were asking me at the time, would my child get COVID? I'm looking at him, he's playing great football. I want to get him out on the field because the scouts were coming and this is coming, and they were concerned about those kids missing their opportunities because it was shut down. And what I related to a lot of them was that reason that people go to the NFL and the NBA and that get to the top tier of athleticism in terms of rewards for those athleticism is because they may be just a millisecond better than their counterparts, either in their thinking or their physical capability. But this virus can take away not only that milliseconds, but thousands of those milliseconds, and now make them average where they were elite. So it's not just the
unhealthy
and unhealthy. It is the healthy that can be affected. So-called healthy kids are being affected. That's a terminology we have to be careful when we state that, because of the misuse that has been done coming out of Tallahassee. But again, I think what we need to make sure of, and that's going to be my final part of my final statement is that this virus doesn't care if you black, white, blue, green, yellow, doesn't care if you're healthy, not healthy, doesn't care how much hair you have,
How much money you have.
how much money you have. It doesn't care. So now, where the money makes a difference if your ability to get the care and compared to the person who does not have that money and access to help. Now we go the whole 9 yards of inequities in the neighborhoods and certain, health disparities and yada, yada, yada. But that's a whole nother subject. So I will end on that. I know we'll run past.
I know I lied because I did forget to mention one thing, Dr. Kane, and you would actually be upset if I did mention this at least. So as we are talking about these things and what we're hearing about a lot right now because we're in Florida is about mRNA vaccines and the data that we have on kids. I just want to remind our listening audience, because I want to make you smarter, that Novavax has filed to the FDA for approval, which is not an mRNA vaccine. And so one of the things that we are continuing to do is emerge vaccines that may be safer for particular groups of people or have better side effect panels or better performance panels. Not until that data is properly vetted at the FDA can I actually return to you what the FDA thinks about the data that was supported, but it's published and it's on Google regarding some of their previous published studies regarding performance. And again, this vaccine is approved in multiple countries already, and the United States process, our regulatory process, it has to go through our process before we actually see if it's going to be approved. But whether this is approved or not, know for sure that both those who are playing in the vaccine space and others who are still developing vaccines will continue to be looking at opportunities to bring the safest, most effective vaccines to our communities. And so don't quit on us yet.
I do know that there are studies out there right now of particular compounds and vaccines per se that are looking to be pan-variant.
Yes.
Right. Looking to be pan-variant proof. In other words, regardless of what the variant is, it just is going to deal with the SARS virus in itself. I don't care how much changes have occurred in the corona and the crown and all this other stuff, that is going to be variant proof is what we're looking at.
Well, that's going to actually be more effective cross variants.
Yes.
I don't know, proof is how I would put it, but and the other thing that's actually happening in the space is looking at ways to vaccinate populations of people, particularly kids, with vaccines that would cover multiple viruses. So not just COVID, but having a vaccine that is developed for multiple things that would put you at risk. So there's a lot in the research space, and what's important though is that we're part of it. We're part of it as educators, as we learn and we share this information, but that we're part of it as participants in these trials. Because unless you have this similar genomic makeup, the efficacy of these vaccines may or may not, and we don't know until the trials are done. So again, we must continue to support.
Lead into next week's show.
Yay!
Next week's show, perfect lead into it, and that is we're doing clinical research and clinical trials, and what African Americans and the various groups of people that disparate trials, disparate participation in trial, and what it means to those to our community not to participate and or to participate in clinical trials.
Well, thank you, Dr. Kane. Thank you, Dr. Johnson.
You're welcome.
A very lively discussion. For our listeners or those who are watching us, sorry we get so passionate about this. I know we went over our hour, but you should feel privileged, because one of the things that Dr. Johnson and Dr. Kane didn't mention to you, they're members of the Northeast Florida Medical Society, which is a local group of physicians, Black physicians who care about the community. They could go to work, do what they get paid to do, and go home, do what they want to with their families. But that's not them, as you can tell. They're doing this because they care about the community, not just at work, but also outside of the wall of their workspace. Listen to them, trust them. We're doing this show not because we're getting paid to do it. We're doing this show because we care about you. We try to bring information from experts, have experts on the show to help you become more informed about how to take better care of yourself and your family. As Dr. Kane said, next week, the discussion is going to be about clinical trials. A lot of us take medication, we eat foods, we use lotion and shampoos and all sorts of products. What we don't know is someone had to be a guinea pig, be in a trial to see if those products were safe for us to use. So next week's discussion is going to be about clinical trials. Is this something that you should consider? The evolution of clinical trials has changed. So what you may have known about it years ago, so many safety practices, safety factors are put into place to help protect us. So tune in next week for pauseforthetruth.com. And of course, we always have to mention, we can't do this show
Tyrone.
without our technology guru, who we affectionately call Tyrone. Call Tyrone.net
Tyrone.
for
I
all
want to
your
call
technological
Tyrone.
needs. And again, stay tuned next week for pauseforthetruth.com. Thank you, Dr. Johnson, as always, for joining us. Thank you, Dr. Kane. Good night.
And thank you, Ms. Turner. Good
Thank
night.